Patients can come and see a genetic counselor for a variety of reasons. For any of the red flags, indicators for inherited breast cancer, such as possibly early onset, a person with triple negative breast cancer, bilateral breast cancer, positive family history of breast or other related types of cancer. So patients come to us from a range of different referral types. Some of them actually have had cancer or have a current diagnosis, and some of them are unaffected. So, we take a wide range of folks when we start genetic counseling. We start out each patient reviewing their family history. So we're going to look for, obviously their cancer history. We're going to look at their screening practices. For BRCA1 and 2, I'm always going to want to know, do they have their ovaries intact or not? Because that's a clinical management implication that could come up. So we're going to ask them a lot of questions about their personal history. I also look at other medical conditions or other medical findings. So for example, if they have a thyroid disorder like goiter or multinodular thyroid issue, that's actually a clinical indication to look at another gene besides BRCA1 and 2. Sometimes we actually measure people's head size because a larger head size, also known as macrocephaly, can be associated with a certain gene known as P10. So a lot of little unusual things that we look for in the genetic counseling clinical history. Once we've looked at the personal history, we also then go to the family history. And as I've mentioned, we look at multiple generations. So 4 generations, we look at the people who have had cancer as well as who have not. For those who have, we look at the age of onset, age of diagnosis, other risk factors to get a good picture of the whole history. The next portion of the genetic counseling session is what I call risk assessment. So we take those factors that we've gathered from the personal and family history and we offer an assessment of, well, how much is your risk for breast cancer going to be increased based on the factors that we're seeing? Or what's your likelihood that you're actually a mutation carrier for BRCA1 or 2, or perhaps another inherited breast cancer gene that we should look at? So I like to put some numbers on it. Usually people, I think, are a little underwhelmed. We see a lot of patients in the 5 to 10 or 10 to 20% likelihood of mutation. But when you think about it, that's actually pretty high to that background rate of 1 in 400. So it's several-fold higher and warrants a definite indication for genetic testing. So I do look at whether they meet criteria we use NCCN guidelines, criteria for testing. I also look at what type of insurance we might be looking at because I want to make sure they meet their insurance criteria for authorization. That's part of what we do is a pre-authorization for genetic testing to make sure it's going to be covered by insurance before the testing is actually run. And then I'll spend a long time with patients talking about, well, what genes are we talking about? And what does that mean if you have a mutation in gene A, B, C, or D? So that they have a good idea of what they might be dealing with. We talk about what kind of clinical management decisions they make. Some women would say in a heartbeat, yes, I would like to have a prophylactic mastectomy. My mom and my sister died of breast cancer. I don't want to do that. Whereas some others would say, no, I think that's a really dramatic decision. I'd really prefer just to perhaps screen with MRI instead of mammograms, have a higher rate of surveillance. So we kind of walk a patient through that decision-making process of, well, what would we do if? Then we talk about the genetic testing, exactly what it's going to tell you, what it's not going to tell you, the limitations. It's certainly not a crystal ball for every health condition, only for the conditions that we're testing, so that a patient can make an informed decision about genetic testing and enable them, if they choose to have testing, to complete the informed consent. There's typically at least 1, sometimes 2 or 3 consent forms that need to be signed as part of genetic testing. So I facilitate all of that. Testing is usually done on a blood sample, so we can often do that during the initial visit. Sometimes we will send what's called a buccal sample or a cheek wash sample as an alternate source of DNA. And there are pros and cons with each of those sample types, obviously. But we send the sample out often that day. It may take as much as 2 weeks, 4 weeks, 8 weeks, depending on what test we're running or what group of genes we're running. And then when the results come back, I typically will report the results initially out over the phone with a good discussion about how, what are the implications of those results. If they're positive, we definitely like our patients to come in so we can map out a strategy about how we're going to deal with that increased level of risk that we now are aware of, as well as talk about how we're going to inform other at-risk family members so that they could take advantage of the genetic testing option if they would so choose. So every step of the way, we walk the patient through it. But then when it comes to the actual management, I help a patient coordinate their care. So maybe they need to go and see a gynecologist, oncologist. They want to have their ovaries removed. Maybe they need to see someone in endocrinology. Maybe they need a breast surgeon who can order the MRI. So I help them connect with all those folks. So genetic counseling is a great process, I think, from beginning to end. And I think a lot of people don't realize all the different steps that we take as part of that process. But it's something I very much enjoy.
Hi, I'm Dr. Jay Harness, and I want to share with you important information that I believe that every newly diagnosed patient with breast cancer needs to know.
I'm a breast cancer survivor.
I am a breast cancer survivor.
I am a breast cancer survivor.
And I want every woman to know
About personalized breast cancer treatment
and the genomic test.
A test that helps guide a woman and her doctor
to the best treatment options for her.
Pass it on.